ashver.com.
Hello and welcome to ashver.com. You are watching an interesting and informative video on getting braces on and what to expect getting your braces off.
Please read the disclaimer carefully.
Why do you need braces? Knowing if you will need braces can be something you've known for a very long time. The evidence is usually the long before you are ready to get braces. There are many different reasons for getting braces, and here are the most common. It is recommended that your children see an orthodontist at an early age. There may be preventive methods that can help correct some of these alignment problems. Crowding when the teeth are too close together. Although you may have crowding at an early age, this may correct itself before you're ready for braces. Spacing when the teeth have too much space between them. This too may correct itself before braces. Overbite. This is a common reason for braces. The top teeth overlap the bottom teeth by an abnormal amount. This can be caused by a child sucking his or her thumb. It can be a characteristic passed down genetically. Although it is common that the top teeth are the problem, sometimes it can be that the bottom jaw is set back and an appliances before or instead of braces may be needed. Underbite. An underbite is just the opposite. The bottom teeth protrude out farther than the top teeth. This can also be caused by genetics, sucking on a thumb or pacifier, missing teeth, or a trauma. Crooked teeth also related to genetics but can be also related to the size of your mouth and teeth. If you have a small mouth and large teeth, it can cause the teeth to grow incorrect. Teeth move through the use of force. The force applied by the archoir pushes the tooth in a particular direction and a stress is created within the periodontal ligament. The modification of the periodontal blood supply too determines a biological response which leads to bone remodeling, where bone is created on one side by osteoblast cells and resorbed on the other side by osteoclasts. Two different kinds of bone resorption are possible. Direct resorption, starting from the lining cells of the alveolar bone, and indirect or retrograde resorption, where osteoclasts start their activity in the neighbor bone marrow. Indirect resorption takes place when the periodontal ligament has become subjected to an excessive amount and duration of compressive stress. In this case, the quantity of bone resorbed is larger than the quantity of newly formed bone. Negative balance. Bone resorption only occurs in the compressed periodontal ligament. Another important phenomenon associated with tooth movement is bone deposition. Bone deposition occurs in the distracted periodontal ligament. Without bone deposition, the tooth will loosen and voids will occur distal to their direction of tooth movement. A tooth will usually move about 1 millimeter per month during orthodontic movement, but there is high individual variability. Orthodontic mechanics can vary in efficiency, which partly explains the wide range of response to orthodontic. What determines the age braces are put on? The first step, like previously stated, is to see an orthodontist at an early age, around 6 or 7. At this age they still have a soft jaw and other steps may be taken to prevent the need for braces. However, if the problems are not correctable, then braces will be needed. It is generally the idea to start braces between the ages of 11 to 15 or when all adult teeth are in place. After this set of teeth are in, be sure to have another visit with the orthodontist. He or she will start the procedure, which will include x-rays and molds or impressions. What to expect when you get braces? It's finally the day and usually patients are excited. The start of the alignment that will lead to a beautiful smile. So what will happen today? Will it hurt? How long will it take? How do they get put on? How will they look? These are all very common questions. So here is what to expect when you get braces put on. Do braces hurt when getting them on? This all varies patient to patient depending on your tolerance to pain. There is no needles needed to numb, and the actual procedure of getting braces should not hurt. There may be an uncomfortable pressure after the braces are put on. How long do braces hurt? This only lasts for a few days after getting your braces on, and each time your braces are tightened. This pressure is what aids in the teeth shift and moving eventually to their final alignment. You may also find that when you first get your braces, your cheek and inner lip will become sore. What to do when your braces hurt? Before your appointment to get your braces on or tightened, your dentist may recommend that you take ibuprofen. To help with soreness from your braces rubbing on the inside of your mouth, you can apply dental wax over the brackets. This will help with the rubbing and prevent soreness. How long braces take to be put on? It generally takes 1 to 2 hours to get the braces completely on. However, it is very common for the orthodontist to only put one set on at an appointment. This gives you time to adjust, and the other set of teeth may not need to wear the braces as long. If this is the case, they may place the second braces on 1 to 6 months later. If this is the case, it will shorten your visit. How braces are put on your teeth? When referring to traditional metal braces, the brackets are placed on first by adhering the bracket to the teeth with a bonding agent. This is the time-consuming step. After all the brackets are put in their correct position, the next step will be attaching the arch wire to their brackets. The arch wire is the wire that is used to put the pressure on the teeth, causing them to shift. The wire is attached to the brackets by using small tight rubber bands or wire. Many kids enjoy the rubber bands because they come in a variety of colors. They may pick out their favorite school color or maybe their team color. The rubber bands will be replaced monthly, making it fun to mix up colors. If there is crowding of the teeth, the orthodontist may choose to use spaces. This can be uncomfortable because of the added pressure between the teeth. Using the spaces will help speed up the process, resulting in less wearing. How do braces look on you? The best part of this is that you will not look like most of the kids you go to school with. Research has shown that 80% of kids wear braces at some point in their life. This is great for having support and not standing out alone. Besides, you can mix and match those rubber bands to give yourself a unique style. Cleaning braces. While you are wearing your braces, you will want to be extra thorough with cleaning. The braces and wires will attract and hold food particles. However, the teeth cleaning with braces on can be time-consuming and difficult. You may find that these tools can help speed you up and do a good job. Proxy brush. This tool looks similar to a Christmas tree and therefore is often referred to as a tree. To use, simply insert the brush under the arch wire and between the brackets to loosen and remove food particles. Floss threader. This tool is similar to a plastic needle. Threader the floss through the eye of the needle and use it to pull the floss under the arch wire and between the teeth. Electric toothbrush. Using an electric toothbrush can help get into and clean small crevices. Water pick. A water pick sprays a jet of water that can loosen food particles that may be hard to reach. Getting your braces off. Getting your braces off can be one of the most joyous days of a child or an adult's life. The years of wearing the braces can quickly lead to the thought of getting the braces off. Many are excited to get the braces, to realign their teeth and to obtain a beautiful smile. This is quickly changed to the thought of getting the braces off, sometimes just days after getting their braces on. Days of eating whatever you want and leaving the extensive cleaning off and become the new focus. Finding out what to expect after getting the braces off will be search many perform. What can I eat? How will they look? How long does it take to get braces off? How will it feel to get the braces removed? What is next for my teeth? What kind of retainer will I get? How do I care for the retainer? How long do I have to wear the retainer? What to expect when you get your braces? How long does it take to get your braces off? How long does it take to get braces off? Although the time it takes to get your braces removed can vary, the estimated time is 1–2 hours. This all depends on what procedures may be done after your braces are removed. The first step in getting your braces off is removing the rubber bands or metal wires that hold on the arch wire. Next will be removing the arch wire. This all takes just a few minutes and should be something you are already used to, since they do this at your monthly visits. After these are removed, the dentist will use a tool to break the bond with the tooth and the bracket. This is usually painless and doesn't take much time either. The last step in actually getting the braces off is removing any leftover bonding agent. This is when you may experience some discomfort. All of this is usually done in 40 minutes to an hour. Any other time that your dentist may have scheduled can be used to make molds for the retainers you will be wearing after getting your braces off, or install the bonded retainers. Do braces hurt when getting them off? First concerns about getting braces off are usually with that the braces are not tightened for the weeks prior to getting them, or reducing the pain in the teeth. A pair of pliers is used to break the bond between the bracket and the tooth enamel. The bonding agent will remain on the tooth. The orthodontist will then smooth off the bonding material and polish the teeth. If you have sensitive teeth, this may be uncomfortable. Taking a pain medication before the procedure is done could be your best option. What can you eat with braces off? Many patients can't wait to sink their teeth into a juicy apple. This is something that is discouraged while wearing the braces. The eating of an apple can easily snap off the brackets, causing an extra trip to the orthodontist. After getting your braces off, you will be able to eat anything that you could before the braces were put on. There are exceptions. If you get a bonded retainer, you will need to remain careful about what you eat. Eating certain things can break the bond of the retainer. Braces off, retainer on. When you get your braces off, you may find that there is another step in the process. This is probably something that was discussed early on, but maybe with all the excitement of getting your braces off, you've forgotten. In most cases, after you get your braces off, you will be fitted with a retainer. Your dentist may choose a bonded or a Pauly retainer. The retainers help keep your teeth from shift and keep your beautiful new alignment. Bonded retainer. A bonded retainer is mostly used on the bottom front teeth. A wire is secured to the back of the teeth by a bonding agent. This retainer is used when the orthodontist feels that there may be movement of the teeth after the braces are taken off. Having a bonded retainer does require special cleaning similar to the braces. A self-threading floss will need to be used to clean between the teeth. Self-threading floss has a stiff end that makes it easier to place under the wire of the retainer. Also, you will need to check often to make sure the bonding hasn't broken. This could cause a buildup of food and plaque underneath and lead to tooth decay. A bonded retainer may be left on for years if the orthodontist feels that movement of your teeth may. Pauly retainer. A removal retainer or Pauly retainer is common after getting braces off. This retainer is often used for the top teeth and is made from a molded impression of your teeth. The advantages of this retainer are that you can remove it to eat, drink and brush. However, you must remember to wear it all the time as instructed by your orthodontist. Anytime it is left out, there could be a shift in your teeth. While a small shift may be corrected by putting the appliance back in, some movement may require the retainer to be just. What to do when you get your braces off? First, check out your result and discuss any problems with your dentist. If you find that your teeth don't look as good as expected, you should discuss the results with your dentist. Sometimes in the first months after the braces are taken off, there may be movement, especially if you're not wearing your retainer correctly. Your orthodontist may opt to put your braces back on for a short time to correct these problems. So what to do when you get your braces off? Celebrate. Go eat without worry and flash those pearly whites around.
Thank you for watching this video. This channel offers motivational, inspirational, valuable and informative videos to soothe, cleanse and inspire your health, mind, body and spirit. You can find lot of interesting videos on wide range of topics here. Stay tuned and keep watching.